Hello, friends. Greta Nance here. My ear just popped. Sorry about that. Need to swallow. We are doing a live Mommy Makeover Q&A today with Dr. Rafi Fredman from Amelia, St. Louis. One of these days, I'm going to do like a rapid fire funny questionnaire for him because he's such a good sport. But we always appreciate his time and expertise. He really carves out time between seeing patients to show up at least once a month on Instagram and answer all of your questions. I got a lot of good Mommy Makeover ones for today. We are going to talk about very specifically breast surgery, then tummy tucks, then liposuction, because a mommy makeover really actually means nothing. It is a marketing term. They are different. Her mommy makeover will be different than my mommy makeover and somebody else's. So it really, let's let Dr. Fredman in here. Breast and body related, usually after kids, but honestly, you could be 24 years old and have lost 60 pounds and want a mommy makeover. There he is again.
Hey.
Hello, sir.
How are you?
I am doing great. Nice to see you again.
Good
we were just on a Zoom together, so I saw you 7 minutes ago. Thank you. I know you're busy.
Oh, no. It's a pleasure to be here.
Well, I'm glad. Well, this is a big topic. I chose a big topic, but honestly, it's the questions that we get the most in Bus Mob or even through Instagram DMs on here. Because mommy makeovers are confusing, and it's a couple different procedures at one time, and everybody's is unique. So we got some questions. I tried to kind of break them down between breasts, tummy tuck, and liposuction. So let's get into it.
Right. Someone asked me yesterday in the Bus Mob Live what my favorite procedure was, and I said I'm going to cheat because I'm going to say mommy makeover. And that just includes everything. So
what is your favorite? I want to do a rapid fire funny thing with you sometime, and that would be one of them.
Yeah, sure.
So what's your favorite surgery to do?
Yeah, it changes. It's interesting how it's changed over time, and that probably just goes with the evolution of a plastic surgeon's practice. But for right now, it truly is mommy makeovers, and most often a mommy makeover for me is a breast lift with an augmentation. That's just the most common. Sometimes it's just a lift, sometimes it's just an augmentation. Most often it's breast lift, implants, and a tummy tuck. It's obviously those different surgeries, and I enjoy the technical aspects of the surgeries, but really to get to be a part of that journey with those patients is so motivating for me, inspiring. It's inspiring for my team. And that really is what at this point has led me to really love those surgeries.
Yeah. The bigger the life change, the more fun the whole thing.
For sure. Yeah.
So
absolutely.
I get that for sure. Okay. So we are talking about mommy makeovers. Let's cover the breast piece first, because the breast part could be anything from just implants. That was included in my mommy makeover. A lot of women need a lift. A lot of women, like you said, choose a lift with implants. Some people choose a reduction. A lot of times, pregnancy, breastfeeding, all the things leaves you not looking the way you ideally would like to. Or you never liked what you looked like before, so you got implants. So there were a number of questions about lift versus reduction, but like specifically this one said, I breastfed my 2 kids and my size never went back to normal. I don't want to be bigger. Should I get a reduction or a lift?
Yeah. So, and a lot of people are confused about, reduction, lift, reduction in implants. What does that mean? So the way that I start with people is, first, are you happy with the size that you are? Do you want to be smaller? Do you want to be bigger? I think that's the best way to start. Like when you're in a bra, forget about shape and position of things, but just overall size, volume. Are you happy with where you are? If someone's answer to that is, oh, I want to be smaller, I definitely want to be smaller cup size, then we're talking more of a reduction, a breast reduction. Now, it is true that with the lift, someone does get a little bit smaller. I often say about a half a cup size, but not a really huge amount. Really, if you want a noticeable change in size, we're talking about a breast reduction. Now, a breast reduction includes a lift. A reduction is a lift, plus you take out some extra tissue. So sometimes I think people get confused and say, well, I want a reduction and a lift. It's the same surgery, but in a reduction, you also remove breast tissue. Now, if you're happy with your size, we just want everything lifted up and reshaped, then we're really talking about a lift. Now, if you want to have more upper breast upper pole shape, or you want to have an increased size, then an implant's going to be needed. Now, breast reduction and implants is a bit of a controversial thing. I mean, there is this concept. It sounds a little weird. Why would you go smaller and bigger? But there is this concept that you can take out a lot of breast tissue and add an implant. It's kind of this minus plus type surgery. In theory, it sounds nice, and I have done it in the past. My experience with it is that it doesn't turn out in the long run as good as you hope it does in terms of upper pole fullness. In people that truly are getting a breast reduction and implants, over time the implants tend to settle a little bit lower. So it depends on the person's anatomy, but I'll in those situations actually more often recommend that the person get a breast reduction and then later get implants if they decide they want to. I think that has a lower chance of revisions. And that's just kind of where I've evolved in practice.
Interesting. Well, I'm going to skip down to this one then, because that one kind of ties into this. A lot of people want to know, is this like a one-time thing? Like, not just a reduction, but a lift, implant, like, will I have to go back and redo this every 10 years or so?
Yeah, so my goal with any surgery is that this is the surgery you have, and I hope you don't need to have another surgery down the line. That's always, the goal in most situations, with exceptions if there is some sort of staging thing happening. But that's always the hope. Now, there's certainly a chance that at some point in anyone's lifetime, they're going to want to, maybe they want to change their size or something, or have to because something comes up, and they want or need some sort of a revision. So people will often ask, like, oh, I have to have surgery every 10 years. That actually comes from something that plastic surgeons used to tell people. We used to say that every 10 years you have to get your implants switched out. And I remember in training would be doing a lot of exchanges for people that had no problems. They were just 10 years, had to get them switched out. And they were perfectly normal implants. And a good question then is, why are we doing this if they're perfectly normal? So we don't tell people that anymore. And by the way, the reason that 10-year thing came to be was because the FDA, who approves implants, approved them based on safety studies that were done over a 10-year period. So they're approved for 10 years. So plastic surgeons said, well, they're approved for 10 years. So at 10 years, you got to get new ones. It's just not actually true. So now we say, if you're not having any problems, you don't have to have them exchanged. You're not signing up for surgery every 10 years. Yes, at some point in your future, you may need to or want to have another surgery, but you're not, again, signing up for surgery every 10 years.
Got it. Yeah, the studies never went past 10 years, right? So
yeah, because at some point you have to stop collecting data and publish it. Otherwise, you'll never have a study. So
yeah, I love that. Well, this question goes along with that then. Is there anything I can do to keep them as high as possible, like this concept I've seen all over the internal bra, or she specifically said Galaflex, which is like a mesh, I believe. Right. Is there anything that I can hold them up for longer?
Yeah. So it'd be great if the answer was yes, do this, and then they will stay the way they are forever. So the problem is that there are too many factors that are out of our control for it to be that simple, and genetics plays a huge role in it. Now, depending on somebody's anatomy, it may be that we feel like, whether at the first time or this, if somebody's having a revision, that we do have to bring in outside reinforcements, which usually would be mesh, to support the implant and lift everything up and give a higher chance of that lasting for a very long time. So Galaflex mesh can be important in certain situations and helpful. Short of that, is there anything that you can do? Some people ask, should I be wearing a bra day and night?
I was going to ask that.
Yeah, and what I tell people is, like, you do hear of plastic surgeons that say that. I think they're probably like old men that don't know what it means to tell somebody they need to wear a bra 24/7. It just, you're not doing this to have to wear a bra all the time. And I don't think in the end it really makes much of a difference. I think your genetics are going to determine how things turn out over time. Again, it'd be nice if that helped, but I think that you just live your life, and hopefully you don't need to have anything else done. But if you do, there are always things to talk about in terms of making things look better.
I love it. I actually like wearing a bra to sleep. I use our Kubi bras that we give after surgery. It just makes me feel better. But now you've dashed my hopes that I'm going to have high boobs until I'm 90. Let's answer this question that she just asked. I like this one. How about, since especially you have that great post that you just did recently about tubular breasts, does the shape of your breast determine what implant you recommend.
So the specific implant that we're going to end up choosing depends on a few things. One really important thing is specific to somebody's anatomy is their breast width. Because when you think about it, if you tried to put an implant that's wider than the space that's going to be there for the implant, it's not going to fit. You cannot fit an implant that's way too wide into a space that's not that wide. It just won't fit. It'll be sticking out through the incision. So when someone asks, is there a limit to size? Yes, there may be, but it's more based on somebody's width than actual CCs. So whether tubular breast or not, what's going to determine the size is one, the person's anatomy and their width, and then their goals, of course. That's why wish pictures and why things like Goal Finder are so helpful, because it allows me to look at these pictures and really understand what somebody's goals are. Tubular breast or not, and tubular breast is a challenging form of anatomy, and everyone's anatomy is a little bit different. Implants are a great way to improve the things that need to be improved in tuberous breast, because they expand the lower part of the breast. And that's exactly what's happened in tuberous breast, is the lower part of the breast is tight and constricted, and you need something to expand it, and an implant can do that. But as far as what exact size and shape depends on the person's measurements and their goals.
But shape-wise, you and I have covered this before. 99.9% of the implants that we recommend are round, though, right?
So thanks for bringing that up. So from a standpoint of round versus shaped or anatomic or teardrop shape, I'm essentially only using round implants because the idea of a shaped or teardrop shaped implant looks nice on a table. When you look at it, it looks more natural. It has more of that lower pull. I don't know if you have any there. Yeah, exactly. So it looks nice. But in reality, when you take a round implant and hold it just like you're holding, it gets this, exactly, it gets a teardrop shape also. So those look very similar. Correct, yeah. Okay, and then it avoids some of the issues of a teardrop shape with it turning on its side or textured, which there's pros and cons to that.
Yes, thank you, sir. Okay, let's talk about tummy tucks. The main part in most people's mind above a mommy makeover. You know, I've had kids or I've had a weight loss and I just don't like anything from my boobs to my hips anymore. But muscle repair is confusing, and I totally understand why. So like this question specifically was, how do I determine how much muscle repair is needed for a tummy tuck or a mini tummy tuck? Because mini tummy tuck always comes into it too. So can you just do a quick overview of like what muscle repair even is in a tummy tuck?
Yeah. So anyone that's had even one pregnancy or even weight changes, there's two things that have happened. One is those six-pack muscles, the rectus muscles that initially are lined up basically straight, move out to the side. They separate out. So that's one thing that happens. The other thing that happens is the whole abdominal wall gets more relaxed and isn't as tight as it used to be. And those are just changes that happen with life and the changes that happen with life. And muscle repair, pulling those muscles together, tightening the abdominal wall, is one of the most important and powerful aspects of a tummy tuck. And that's why it's always part of a tummy tuck, in my experience. Sometimes people will say, oh, I did a tummy tuck without muscle repair. And I don't think that's a great thing to do. I think that if somebody's a candidate for a tummy tuck, they're going to benefit from muscle repair. Now, how much muscle repair? The right amount for them. And it just depends on exactly how far spaced out their muscles are and how relaxed their abdominal wall is. And whatever's needed to pull those muscles together and tighten their abdominal wall is what needs to be done. And you know, your surgeon can tell you afterwards how far separated your muscle repair was, but it's important to do it in a tummy tuck. I've seen, you know, a handful of revisions from other surgeons where they didn't do a muscle repair, and it doesn't make so much sense to take out extra skin, pull everything down and all that, but then still not have the core tightness or strength or contour that you get with muscle repair.
Yeah, so good. So a full tummy tuck, where does the muscle repair start and stop versus I get a lot of the mini tummy tuck muscle repair question? Yeah, so a muscle repair should be from where the muscle starts to where it ends, which is right, like right here. So in between the rib cage, the xiphoid area, so kind of the bottom of the sternum, from there
all the way down to the bottom, to the pubic bone, basically. So you want it to go all the way down. If you think about it like zipping up a corset, think about what it would look like if, let's say, you just zipped up the bottom part of the corset. The top part would be bulging out.
Yep.
So it's not really a good idea to just zip up the bottom part. And yes, you do hear of many tummy tucks being done where there was just a lower muscle repair. But I don't think that usually looks good, because then everything's got to go somewhere. So it's going to come out through the top. So I believe even in a mini tummy tuck, that you should really repair the full length of the muscle. Why is it not done all the time? It's pretty hard to do, because in a mini tummy tuck, your incision is low. You're not cutting out a lot of skin. So you're working really far away from where the incision is. And just from a technical standpoint, that's challenging.
That visual is so compelling. I think every woman has like pulled on Spanx and only gotten them halfway. And it's like, there's a whole roll at the top. So that's very helpful. The question that somebody asked, which is so common, is how long after my last child, even breastfeeding or no, should I have a tummy tuck? Because, you know, we've all heard of these celebrities that say they got a tummy tuck right after the C-section, which sounds horrifying to me.
Yeah. So I can't believe that that's something that people used to do. Tummy tuck in the it's not a good idea for a few reasons. One is you have a newborn, so I don't know how you're going to recover from a tummy tuck and have, you know, a brand new baby. But also just because you want to go into any body contouring surgery, whether it's breast or abdomen or anything, with your body not going through a lot of changes. And obviously there are a lot of changes that are happening after you have a baby. So you want to wait until you're kind of done changing for the most part. So how long that is a little bit different for different people, depending on the person's anatomy and which kid it is and just their genetics. But you know, generally this 6 month to a year time frame is when changes are starting to stabilize, and that would be a reasonable time to say, okay, there aren't going to be a lot of changes happening. You know, now we can move forward. So a year is a good amount of time. And also you got to think about, just from fitting this into your life and all that, when is it going to, you know, when are you going to feel okay in terms of the baby and having, you know, the help you need and things like that. So those are important things to consider too.
Says the guy who has a new baby right now and is probably like, I can't imagine recovering and having a newborn at the same time. How's fatherhood going with 3?
It's going great. It's a lot of fun.
They're very cute. What are dog ears?
Yeah, it's not a good term, unfortunately. But what it is it's just used to describe if a surgeon cuts out something that's the shape of a circle and tries to close it, there's going to be puckers of skin on the side. And that's why if a surgeon's taking out a mole or something, you don't actually just cut out a circle, you take a little bit more skin and tissue on the end. So it's the same idea with the tummy tuck. If you don't make the tummy tuck incision long enough and you don't take out enough skin towards the side, when you pull everything down, there's going to be a little pinch of skin at each side that puckers out. And that's what a dog ear is. It's important to try to prevent it by, one, making the incision as long as it needs to be. It's not worth it to have a shorter scar, but then dog ears that you later need to have a revision for. It's also important during the surgery. I'm very intentional. At the end of surgery, I look at the end of the incision, and if I think that even there's a chance that there's a dog ear or anything like that, I'll make the incision a centimeter or 2 longer. Again, I'd rather that incision be a little bit longer than have a dog ear. Now, sometimes it's really hard to see because the swelling that happens right away during surgery, it can make it look like there's no dog ear. And then when all the swelling goes down, there's a little bit of extra skin. So dog ears can happen. They're not common, but the good thing is that if they do happen, they're really easy for your surgeon to deal with afterwards. Usually we wait till about a year if it were to happen, because you want to make sure all the swelling is gone and it's not swelling. But it's like removing a mole. You can just numb up the area, take it out. There's no recovery or anything. So it's not common, but if it does happen, it's easy to deal with.
Got it. What if after my mommy makeover, I lose 10 to 15 pounds? Is anything dramatic going to happen?
So it may result in some changes. So there's this 10 to 15 pound. That's usually what I tell people is if you're going to lose more than 10 to 15 pounds, so more like 20, 30, you want to lose that weight before, because if you lose more than 10 to 15 pounds after, it could be that you feel like there is more skin that could have been removed, or the breasts sit lower if you had a breast lift or something. So it's important to go into surgery at a stable place from a standpoint of body changes. But also life is life, and you can't always predict everything, and things are going to happen. So you do the best that you can. And again, genetics plays a role because everybody's a little bit different.
Yeah. Honestly, I see a lot of people that happens to them because they're so motivated after their
Yeah.
People are excited to be back in the gym and stuff.
Yeah, and it's a good thing. It shouldn't be that you have this, you're confident, you're feeling good, your core is strong, and you're like, I can't go to the gym because I can't lose any weight.
Yeah.
No, and actually the people that have the most dramatic results after tummy tucks are people that do the surgery and they are in the gym and they're getting more fit. That's when you really see, I think, the most significant changes.
Yeah, I love that. Someone asked about liposuction during a tummy tuck. It's included at Amelia, but not always everywhere. Can you tell me where liposuction is done during a tummy tuck?
Yeah, that's an important question. So the goal of tummy tuck, of liposuction during a tummy tuck is a few things. One is to help give you as much of a waistline as possible. And it turns out that in order to help contour a waistline, you can't just do liposuction on the side of the abdomen. You actually have to go as far back as I can reach during surgery, and I really reach around towards the back, because it's that area, that flank area, that by doing liposuction there, it actually has a big impact on the waistline. So that's why that's really important. And then also it's important to do liposuction in just across the whole stomach area, abdomen area, to help give as flat of an abdomen as possible. So that's all included with the tummy tuck.
Got it. Do you go all the way up under the breast? Because I feel like I used to hear back in the day that was like dangerous.
I do, and I think it's important to do liposuction all the way up under the breast. And it is correct that it used to be that plastic surgeons felt that was not safe. There's two sort of discoveries that allowed plastic surgeons to know how to do liposuction there safely. And one is that when a surgeon does a modern tummy tuck, all the blood vessels, or many of the blood vessels that supply oxygen and nutrients to the skin over the abdomen, they're not cut, they're left intact. And as long as you leave those intact, you can do liposuction in the abdomen safely. The other thing is we now know more about where those blood vessels live and what layers. They actually live in a very specific layer of fat. And as long as you know where they are and know where to avoid, you can do liposuction there. But that does bring up an important point that in a tummy tuck, there is only so much liposuction that can safely be done. Sometimes afterwards, people will say, well, I still have some fat here. And you have to, because it wouldn't be safe to take everything, because then it would potentially could cause issues with the skin.
So good. I'm glad you covered that. Well, that leads me, we had another question that was like, hey, I want a mommy makeover. I don't need a tummy tuck, but I want extensive liposuction and implants at the same time. Kind of how many areas can you do at once? And what's the recovery like from extreme liposuction and a breast augmentation?
Yeah, the first thing that I would want to make sure with that person is liposuction alone going to really give them the result they're going to be happiest with? Because it's not uncommon for somebody to want that, because then you don't have the scar of a tummy tuck. But especially if you've had at least one pregnancy, usually there's some extra skin, usually there's some muscle separation. And if you do liposuction alone, you're just going to have more loose skin and may not have the result that you want. So that's the first thing to start with is really liposuction the right way to go, or should we be talking about a tummy tuck? Because most often tummy tuck would be a better answer. But let's say you are somebody that really liposuction is what we're going to do. There are limits to how much liposuction you can do and should do during a surgery. It's different in each state. In Missouri, it's 5 liters. I think North Carolina is the same. But even short of that, you have to think about overall what's the person's recovery, how much can you safely do. When it comes to combining surgeries, you have to think about how is each procedure going to impact recovery. So, if somebody wants to do a thigh lift and an arm lift and, breast lift and abdomen, we're not leaving you with many limbs to move around with. So you just have to have a good conversation with your plastic surgeon as far as what are the surgeries you want, and may make sense to break them up into more than one.
So liposuction looks the worst when you're watching it. Is it hard on a surgeon to do?
So it is both the most physically taxing part of my job, And it is actually the most mentally, intentional that I am during the surgery. And it doesn't look like that. It looks, if you watch videos, which I don't know if people should do, but it looks kind of, aggressive and not when you think of like fine surgical movements, right? But it actually is, there's a lot that's happening. The surgeon is constantly with their non-liposuction hand, really getting a lot of information as far as where that liposuction cannula is to make sure it's in the exact right place it should be, feeling the tissues. There's just so much happening, and it requires a lot of focus, and is also physically tiring, and I often end up sweating at some point during it.
I recorded my whole tummy tuck surgery, and that was one of the surprising things. The other one was that he did liposuction first. Yeah. And just like what you were saying, and then I was left with even more skin than I thought.
Mm-hmm. Yeah.
So I think, thank God he didn't do the tummy tuck first and then liposuction.
Yeah. Yeah.
Sequence.
Yeah. You always want to do liposuction first because that may change how much skin you can take out for sure. Yeah.
Mm-hmm. What if I had a tummy tuck maybe 5 years ago and now I want liposuction? Is there a problem with scar tissue?
No. So doing post tummy tuck liposuction, if you're a good candidate for it, I think that's a great thing to do. I enjoy doing it because once you've had a tummy tuck, now I can be a little bit more aggressive with the liposuction, not quite as limited in terms of blood supply and things like that, because the tummy tuck isn't being done at the same time. So yes, there is scar tissue, and liposuction after liposuction's been done, or tummy tuck's been done, I will have to work through some scar tissue, but that's not so uncommon that I'm doing liposuction in the setting of someone that had liposuction before, or some sort of, Vaser, cool sculpting, something.
Perfect. I'm being aware of your time. I've got two kind of recovery questions that I hear all the time, and this one even. Well, let's cover this question because it's a good one, Amelia. What about kids post tummy tuck? What if I have a tummy tuck and decide I want more, or what's going to happen to me?
Yeah, so if you've had a tummy tuck and you end up having more kids, from a safety standpoint, it's fine. Your body is fine. Your body can do whatever it needs to do. Your stomach will be able to do what it needs to do. So it's not a unsafe thing to do. Mm-hmm. However, it may affect your final results because the changes that led you to need a tummy tuck in the first place, or want a tummy tuck in the first place, are going to happen again. Everything's going to stretch out, muscles may separate. So you may find yourself afterwards wanting to have another tummy tuck. And sometimes that happens. Mm-hmm. So in planning, tummy tuck is a surgery where, not for everybody, but it may make sense to wait until you're done having kids. I do occasionally have a younger patient that they don't know if kids are in their future. It's not really on their mind. And this is something they really want to do, and they understand they may need to have another surgery. And I think that's a reasonable thing to do. But if you do have a plan of having future kids, it may make sense to wait until you're done.
Did you see that question about, are the sutures for muscle tightening permanent? Like, wouldn't the re-stretch if you had another kid rip it?
Yeah, that's a good question. So some surgeons use permanent stitches. Some people use dissolvable stitches. I use a permanent stitch for that muscle repair. It's not going to stretch tissues. I mean, permanent stitches are used throughout surgery. General surgeons use it. Trauma surgeons use it. And body changes don't cause tearing through tissues and things like that. So your body's going to be able to do whatever it needs to do, and the stitches aren't going to hold it back. The tissue's not going to tear. The stitches aren't going to break.
Mm-hmm. How about a BBL and a Breast Aug as a combo surgery? Is that something you recommend or no?
Yeah, those surgeries can go together. Mm-hmm. And because one recovery doesn't affect the other. Mm-hmm. Tummy tuck and BBL, I don't recommend together. Mm-hmm. Because after tummy tuck, you're not going to be able to lay on your stomach. After BBL, you can't lay on your back, so it doesn't really give you anything to do. But implants and a BBL is fine.
Awesome. How much time do I have to take off work after my mommy makeover? I'm a nurse. Yeah.
We have a lot of patients that are nurses, and I always ask them what type of nursing they do. Everybody has different roles and things like that. In thinking about how you're going to fit this into your life and your job, you have to think about kind of how you're moving and walking and feeling afterwards. So for that first week, you're going to be walking bent over slowly. You're not going to want to be going back to the hospital, back to work like that. Between week 1 and week 2, you're able to stand up, sometimes totally straight or nearly straight. Usually by week 2, people are standing up straighter and walking pretty normally. You're still going to be a bit tired. You don't have all your energy back, but it'd be pretty common after a mommy makeover for a nurse to go back to work. Sometimes at 2 weeks, depending on what they're doing. Sometimes a little more like 3 weeks or even 4 if they have a more physically active job, if they're an ICU nurse or working in the OR. But what I tell everyone is when you do go back, you're going to have to modify the way that you do things. Mm-hmm. So you're going to have to plan before, okay, I'm going to need to have somebody else transferring the patients. I'm going to need to have somebody else doing chest compressions. So those are things you have to think about before so that when you go back, you're not put in a position that you don't want to be in.
Mm-hmm. Everyone tries to time this around like kids at the pool all summer. So when would, after say a tummy tuck and a breast lift with implants, when would I look like normal at the pool where, you know, the Karens aren't going to talk about me?
Yeah. I think 6 weeks is fine. A lot of people, I mean, before 6 weeks, you can't go in water and things like that. But I have a lot of patients that at 6 weeks plan a vacation after a tummy tuck. Now, you're still going to have swelling. You're not going to have your final result, but I think it's fine to be out and by a beach or by a pool. You have to keep your scars protected from the sun. So, you know, I think 6 weeks is okay. If you really want to wait until the swelling is in a really good place, you know, 3 months, 6 months is a little bit better. And just for reference, when you're looking at before and after pictures, most surgeons take their pictures either at 3 months or 6 months. We do 6 months now, just so you kind of know at what stage in the process that is.
Yeah, everyone is different. I didn't have that much swelling at 6 weeks, but I still had bruising from the liposuction, like in the back for sure. So, but I don't care what anyone else thinks either. All right, 12:40. Are you okay, or do you need to run away?
We do a few more minutes.
Okay. What someone asked about options for scars afterwards, like, you know, at Amelia, we have a protocol up to, you know, 6 weeks and then further, but laser, microneedling, like what if someone's really worried about that scar?
Yeah. So first of all, talk to your surgeon about it because there definitely are things that can be done along the way to help with the scar. There are well-proven things to help with scars that don't require procedures and things, whether it's silicone tape, massage, certain scar gels, those things are helpful. Microneedling, actually, there's some recent research on microneedling and scars, doing that even early on, and that can help. One thing that's really well known to help with problematic scars are steroid injections. So sometimes if somebody has what's called a hypertrophic scar, where that scar is really thick, really red, and not going down, you can do a steroid injection to help. You also have to remember that scars go through this process in the first year. And it's normal for a scar at 6 weeks, 3 months, even 6 months to look not so great. That's normal. It's going to take a year to 2 years to really fade to that fine scar.
Got it. I'm throwing this at you. This might be a complicated one. Who can't have a mommy makeover? And this made me her heart murmur question, but I literally answered this today. I'm like, no, you can't smoke, you know, and no, this BMI won't, like, this is a big procedure. So who is out for the mommy?
Yeah, so you can't have a mommy makeover if it's not safe for you to have the surgery. So if you have certain medical problems that would mean that I don't feel that it's safe and we don't feel that it's safe for you to have this surgery, then either you can't have it in the setting that we do surgery, you may need to, you know, go to a practice where they do surgery in a hospital, or maybe that it's not a safe procedure to have. Smoking, you should not have the surgery if you're actively smoking or vaping or any nicotine products. It's not safe. It can cause problems with necrosis, and it's not a good idea. High BMIs, you know, also something that we know to have increased complications over 35. So that's another time that you'd want to modify things. So those are the general times when we would say either now's not the right time or we're not going to be able to do this.
Yeah. And the heart murmur thing, I mean, I get a lot of those random questions sometimes. Obviously, like we have anesthesiologists on staff who would see and evaluate that. It's so different per person. At least in my experience, having one, it was not an issue, but it is something that a clinical team member beforehand, you could call at Amelia and probably get more specific information because that's very vague, right?
Yeah, and most heart murmurs in young, healthy people are nothing. And the thing is I'm a plastic surgeon and I'm not a heart doctor or lung doctor thing. So I will really rely on my colleagues that specialize in things to determine that I'm not going to determine that someone's safe for surgery. So we will often say if someone has a heart murmur, you got to see your cardiologist. And if they say it's safe, then it's safe. If someone has diabetes, you got to see your medical doctor. And if they say you're in a good place, you're in a good place. And that's how we know we're going into it with all the people who know all the things they need to know about what you have cleared you.
Got it. Okay, 2 more, and then I promise I'll cut it off because these are good questions coming in. I'm not sure what this is. She asked, how common is an incisional hernia after a tummy tuck? I don't really know what that is.
An incisional hernia is the term that's usually used to describe when someone has a hernia anywhere, really anywhere in their abdomen from a prior surgery. It can be at the belly button, it can be somewhere else. So an incisional hernia after a tummy tuck, so a tummy tuck isn't going to put somebody at risk for a hernia because we're not opening up the abdominal wall. It's not open abdominal surgery like an appendix or gallbladder or something. So a tummy tuck itself is not going to increase the chance of an incisional hernia at all. Now, if somebody already has a hernia, then that's when we need to talk about, is it something really small that I would fix during the tummy tuck? I see hernias like at least 80% of the time during a tummy tuck. It's really amazing. And they're usually belly button hernias. They're just so common. They're usually very small. And I put a couple stitches in it, that's it. They're not big, they don't need mesh or anything like that. But if someone has a bigger hernia, if it's a bigger incisional hernia or belly button hernia or any kind of hernia, then that's something that I would have a general surgeon fix before the tummy tuck, usually 3 months before, ideally laparoscopically, and then I would do the tummy tuck later.
Got it. Do you offer J plasma? And what is that?
Yeah, J plasma is one of the minimally invasive technologies. It's actually a really great technology. I don't offer it, but it is one of those technologies out there that can tighten things using different energy. So it's out there. I haven't found it to be needed to get great results. That's not why it's something that I have, but it is something that's out there and does have good research behind it.
I'm totally going to Google it now. Thank you. I hope we didn't put you too far behind.
No,
I apologize to whatever patients are waiting, but I hope we got to everyone's questions. And we are already set up for our live next month too. So thank you, Dr. Fredman.
You.
We will be saving this so you can watch it if you missed the whole thing.
Sounds good. Thank you so much.
Bye.
Have a good day. Bye.